Hello beautiful people! If you have stretch marks and you're thinking of getting this cream or that cream to help erase them, then you need to watch this video and not buy those fake creams. My name is Dr. Swati Cannon and I am a cosmetic dermatologist out here in California. In this video, I'm going to break down fact from fiction when it comes to stretch marks and tell you what actually works versus what's just hype. What are stretch marks? So technically stretch marks are scars. The dermatologic term for stretch marks is striae distensae, and if they're red, they're called striae rubra. If they're white, they're called striae alba. Usually early stretch marks are red or pink, and then as they mature, they're going to become wider and have more of an atrophic or thinner quality to the skin. Stretch marks occur because when the skin stretches so abruptly or too quickly, the collagen and the elastin get broken down, which then causes your body to make the scar form of collagen and elastin, leading to stretch marks. When we look at the microscopic pictures of normal skin versus skin with stretch marks, we can see that in the normal skin, the collagen, which is the pink part of the dermis, it's arranged in this like parallel fashion. But when we look at stretch marks, the collagen arrangement, which is that pink part, which is in the dermis, that's arranged in a haphazard fashion, and that is very typical of a lot of different scars, including stretch marks. So when we're thinking of treatment modalities, including creams, we really have to think about converting the scar-like collagen to normal collagen. People can get stretch marks on their lower back, their hips, their butts, their thighs, underarms, around the armpits, breasts, and abdomen, and the lower back. Who gets stretch marks? About 90% of the world's population actually gets stretch marks, and it can affect both men and women. So they're particularly common though in a few scenarios. One of them being obviously pregnancy. So about 75 to 90% of pregnant women will get stretch marks. And this is because that belly is growing and growing. And it is, even though 9 to 10 months of pregnancy is a long time, that's still a quick stretch that can lead to stretch marks in people who are genetically predisposed. Puberty is also another common time when people can get stretch marks. So in puberty, especially if you have a rapid growth phase, we will see stretch marks on like the lower back or the hips or the thighs. Rapid weight changes can also lead to stretch marks. If you lose a lot of weight rapidly or if you gain a lot of weight rapidly, your skin doesn't have enough time to adjust, and so you can get stretch marks. Genetics. Obviously, we can blame our genetics for almost everything, but if your parents had stretch marks, likelihood you will get some too. And then certain medical conditions or medications that cause excessive cortisol. So when you have excessive cortisol, this can lead to stretch marks if you produce too many steroids in the body, or if you're taking too many steroids for whatever medical condition. By the way, if you have tried certain products for stretch marks and whether they were helpful or not, let me know and comment below. I will respond to you. And please hit that subscribe button so you can stay tuned with the latest videos that I have coming up on my channel. What creams and ingredients can help for stretch marks? And no, it's not cocoa butter, even though this is like a very commonly touted myth. So let's actually talk about science-based ingredients that can make a difference. The first one being retinoids. So retinoids are not only helpful for acne and anti-aging, but they're also very helpful with collagen and elastin stimulation. So retinoids is really kind of, in terms of creams, it's a gold standard. You want to start using a prescription strength retinoid usually, as that's going to be more effective than what you can find over the counter. But you want to start using retinoids in the beginning signs of your stretch marks. So right when you first start seeing them, because it's going to be a lot more helpful at the beginning than later on. Of course, if you're pregnant, retinoids are not recommended, so I will discuss other treatment options that you can do. There have been many studies that look at the effects of retinoids on stretch marks. So this one particular study kind of shows that tretinoin, which is the prescription form of retinoid, reduced both the length and the width of the stretch marks by about 14 and 8% respectively after using it for 2 months. So 14 and 8% is like very low. That's not like a big difference. So you just have to keep that in mind, that skincare, while it's helpful, it's not going to make such a dramatic impact. I will give product recommendations, so stay tuned. And if you want to learn more about the research that I will mention, please look at my description. I will have links. The second ingredient that's helpful for stretch marks is hyaluronic acid. So hyaluronic acid is a humectant, meaning that it draws water and it helps to hydrate the skin. So if you use products that contain hyaluronic acid plus glycerin, you can really help moisturize the skin. The hyaluronic acid also helps with collagen stimulation, especially for stretch marks, and it regulates inflammation and helps with wound healing. The nice thing about hyaluronic acid is that it is safe to use during pregnancy, so you can definitely massage your belly with hyaluronic acid based moisturizers. There's actually this one study that showed that applying hyaluronic acid consistently during pregnancy decreased the likelihood of getting stretch marks. The third ingredient for stretch marks is Centinella asiatica, or sicca. for short. The other name for this is Gotu Kala, which is actually an Ayurvedic herb that I even grew up with my grandfather. So this particular herbal extract does help to synthesize or to make collagen and elastin when it's applied consistently on the area. And it also improves the orientation of the collagen. So remember earlier on in this video, I showed you that the stretch marks have this haphazard bundles of collagen. Cica actually helps to reorient these bundles to a more parallel fashion. There was a study where they looked at Cica and its application on the skin, and they found that there was in fact increased collagen and elastin production and also increased skin elasticity. All of these things can help stretch marks. Vitamin C is the other ingredient that can potentially help with stretch marks, again because vitamin C is needed to make collagen. Research though on its use in stretch marks is fairly limited, but it is safe to use topically during pregnancy, so it's one of the ingredients that I do recommend using. And peptides are also helpful to build collagen. Peptides are short amino acids, which are the building blocks of protein, and collagen and elastin are proteins. So if we can apply peptides, then we can hope that the body will use these peptides to make more proteins like collagen and elastin. But again, the use of peptides regarding stretch marks, that evidence is fairly limited. And so while peptides are not harmful and theoretically they should help with stretch marks, we don't have that many studies to back up their use. However, they are again safe to use during pregnancy, and they come in various different moisturizers. So I do recommend my pregnant patients use peptides to minimize their risk of stretch marks. Glycolic acid is the other ingredient that can also help with collagen production. Glycolic acid is an exfoliating acid. It's in the family called the alpha hydroxy acids. It's a smaller acid molecule than some of the other ones, and so it can penetrate deeper and help with collagen stimulation. We have some evidence that glycolic acid can help with the white stretch marks or the thinner stretch marks, but in order for this to be effective, you do need strengths that are greater than 20%. By the way, all of these ingredients are also really helpful for your face and neck and for just a skincare routine. If you want to learn how to incorporate all of these ingredients, I do have an entire playlist where I have separate videos on vitamin C, retinoids, hyaluronic acid, peptides, moisturizers, and how to kind of create a skincare regimen using all of these ingredients. So what about the more typical ingredients that we hear about? So these include cocoa butter, shea butter, vitamin E oil, olive oil, and other oils. So while these oils can be helpful to moisturize the skin, scientific evidence doesn't support their use for stretch marks. And we have done studies to see if these ingredients help, and they do not. And the reason the oils and the butters don't really help that much is because they don't really penetrate that deeply into the deeper layers of the dermis where we need collagen remodeling. And these oils have not really been shown to improve collagen or elastin synthesis. So they're not really the right ingredients to help with stretch marks. There was some buzz though about using bitter almond oil for stretch marks, but that evidence was pretty limited. What the paper did was they massaged with almond oil and they found a reduction in stretch marks. And in fact, we know that massaging can help in reducing stretch marks. So whether it's the almond oil or the massage, we don't really know unless we do a placebo-controlled trial. However, almond oil is not technically harmful, so if you want to use something during pregnancy, you can massage your belly with almond oil. And usually you want to do it for about 15 minutes at a time and 2 times a day. So you need a lot of massaging during pregnancy to minimize stretch marks. It's very hard to minimize stretch marks in other parts of the body. So for example, I don't think anyone's going to sit around during puberty and massage their hips and thighs and lower back. You're not going to really prevent stretch marks from other causes, but if you do see the beginning signs of stretch marks, that's where these creams can be helpful. So some product recommendations for stretch marks include one of them being the tretinoin 0.05% cream. This is a prescription cream and it's a prescription strength retinoid, and this is really the lowest percentage that could be helpful for stretch marks. So if you get over the counter or something below this percentage, chances are that it won't be as effective. I think nowadays it's fairly easy to get a retinoid prescription because there's a lot of online pharmacies and a lot of teledermatologists who can give it to you without having to go into the office. The prescription strength tretinoin that I like is made by Skin Medicinals, and it also contains hyaluronic acid. So you have 2 ingredients that are helpful for stretch marks in one product. There was another study that showed that tretinoin combined with glycolic acid greater than 20% and ascorbic acid, which is the form of vitamin C, that this trio was helpful for stretch marks. You can definitely combine all these 3 ingredients to help with your stretch marks. You just can't use a retinoid during pregnancy, but you can use the other ingredients. Paula's Choice Body Retinol is another really good option for using over-the-counter retinoids for your stretch marks. Obviously, again, it's not the same as using the prescription strength, which is what the studies are based off of, but something's better than nothing. Paula's Choice also, by the way, contains other hydrating ingredients, so it's a good moisturizer. Versed Body Retinol is another good option. It contains encapsulated retinol, which means that the retinoids release slower, as well as squalane, which is a helpful ingredient for moisturizing. Naturium Glycolic Acid Body Lotion is a pretty good lotion. It's reasonably priced at about $17. It's only 10% glycolic acid. Most of the studies are based off of 20% glycolic acid. But this particular version also contains glycerin and other moisturizing ingredients. So I think it'd be really helpful to just get that journey started. The Ordinary Glycolic Acid, which is this red liquid, this contains 30% glycolic acid, but also 2% salicylic acid. So this can be helpful and it's over the counter. However, you cannot use the beta hydroxy acid, which is BHA, also called salicylic acid, during pregnancy. So glycolic acid is helpful during pregnancy, but not salicylic acid. You cannot use it. It's teratogenic. Replenix Glycolic Acid is a 20% glycolic acid cream. It's about $42. It also contains vitamin C and other antioxidants. So I think it's a really great option for stretch marks. Verum Moisturizer, Verum. It's not readily found. There were like 1 or 2 studies that used Verum Moisturizer when they were studying stretch marks, and they found an improvement. This particular moisturizer contains hyaluronic acid as well as other vitamins. And so it contains certain ingredients that can help diminish the look of stretch marks, but it's just not as easily found. And when studies were looking at this particular moisturizer, all of these creams were applied using, with massaging. And so it's really hard, again, to know if it's a massage or the cream that really helped with the stretch marks. By the way, if you have tried any of these products or any other ones that I haven't listed, please let me know. And let me know if they worked or didn't work for you. Trofolastin is a Spanish cream that has centinela, peptides, and other ingredients. It was studied with about 80 pregnant women. About half of these women used the trofolastin cream and the other half just used a placebo. So this is a placebo-controlled trial. And they found that the Trofo group actually had 50% fewer stretch marks at the end than the group that just used a placebo cream. So I think this is something that you can definitely use during pregnancy or even if you're not pregnant. Silicone scar sheets are also really helpful. So I tend to use silicone scar sheets for scars or to minimize scars, especially after surgeries. However, if your stretch marks are relatively new, you can use silicone scar sheets or silicone-based scar gels to hopefully help with collagen synthesis. The way it works for traumatic scars is that it tricks the stratum corneum, so the topmost layer of the skin, into thinking that there's no injury. So therefore you make normal collagen, not the scar collagen. So theoretically, it should help with stretch marks during the beginning stages of stretch marks, and it's safe in pregnancy. La Roche-Posay Cicaplast is another really great cream. It's very moisturizing. It contains centinela as well as other moisturizers, and it can be very helpful to minimize stretch marks during pregnancy or outside of pregnancy. Strivectin Advanced Moisturizer is another product. This one contains peptides, hyaluronic acid, as well as other ingredients to help minimize the look of stretch marks, but it is on the pricier side. Alastin Body Transform. Again, Alastin has a lot of products that's made with their trihex peptide technology. And so this is just a group of peptides that they have patented. But peptides are the building blocks of collagen, so this could potentially help with stretch marks. And it's safe to use during pregnancy. SkinCeuticals Epidermal Repair is another option. It is on the pricier side. It contains centinela as well as beta-glucan, which is helpful to moisturize. It's about $90-ish, and so you can definitely try it, but it is on the more expensive side. Some cheaper alternatives include the Neutrogena Hydro Boost, which contains hyaluronic acid as well as other moisturizing ingredients. It could be helpful to use this to massage the affected area. And you can combine the Hydro Boost with like the ordinary buffet serum, which is also very cheap, and the buffet serum contains a whole bunch of peptides in there as well. So you can mix and match different ingredients if you need to get the best results for you. So I really like Korean products because I think they're so much more advanced than American ones. And there is a Korean product for stretch marks. It's called Skin 1004. It's not as widely spoken about, but it contains like hyaluronic acid, centinela, peptides, and it's only about $20. So it contains a lot of the different ingredients that could be beneficial for stretch marks. I usually, recommend you try the cheaper products, but I give you products from all different price ranges. By the way, stretch marks and cellulite kind of go hand in hand. So usually patients tend to have both. My next video will be on cellulite and the different treatments that are helpful. So make sure you hit that subscribe button so you can stay tuned. So more than really skincare, in-office procedures is how we get get more dramatic results for stretch mark improvement. Now, usually if you're pregnant, I don't really do any in-office procedures. I wait till you're done. But for stretch marks on other parts of the body, we can definitely treat them. It's much easier to treat them when they're red and they're in the beginning stages versus more mature stretch marks. For red stretch marks, the best thing to do is to use a laser that targets the redness. And these lasers include KTP, PDL, or IPL. In my opinion, KTP and PDL are better than IPL. IPL is technically a light-based device that I like for sun damage, but I don't think it has the most efficacy for red things on the skin. So these particular lasers target the blood vessels to help reduce the red color from the stretch marks. The nice thing is that the heat from these lasers also helps with collagen production. So it also helps with the skin tightening and to get that skin texture back that's similar to normal skin. For white stretch marks or to get textural improvement with red stretch marks, we have to use devices that cause collagen remodeling. So these devices include microneedling with radiofrequency or fractional laser resurfacing. So microneedling with radiofrequency is more effective for stretch marks than microneedling alone, again, because we need that heat that gets delivered at the depth that we want to be able to cause collagen remodeling as well as elastin remodeling. So microneedling with radiofrequency, there's multiple devices on the market, the most famous one being Morpheus. However, I tell patients don't just look for the device, it's really the operator of the device that matters more. And so we have a RFMN device in my office as well. Multiple treatments are needed. I usually say about 6 to 8 treatments for collagen remodeling that are spaced 4 to 6 weeks apart. Usually I will put topical numbing cream, and we also have a weak version of laughing gas called Pronox, which takes the edge off, but you go back to normal once you stop inhaling Pronox. So we have different ways to decrease the pain, and usually we do have to penetrate a little bit deeper for stretch marks. Again, if you remember this path picture, we have to get to the depth, the correct depth for stretch marks to help with remodeling. I tend to use RFMN for darker skin patients because there's less risk of discoloration. However, fractional laser resurfacing is really kind of the gold standard for textural improvement with stretch marks. And I can use this in skin of color patients as well, but they're just a slightly higher risk of discoloration. What fractional lasers do is that they create channels into the skin. There's also heat involved, which then causes collagen remodeling, and it actually transforms the collagen bundles from a haphazard pattern that characterizes scars to a more normal pattern of collagen. Again, multiple treatments are needed, maybe not as much as RFMN, but multiple treatments are needed, and it does take time to see results. I tend to combine RFMN and fractional laser resurfacing with other modalities like PRF, like platelet-rich fibrin, or PRP, platelet-rich plasma. PRP and PRF basically help with wound healing, especially, when we're penetrating deeper with these devices. It takes a little bit longer to heal the wound. So PRP and PRF can help with wound healing, and they augment the collagen production. I will sometimes also use polylactic acid or Sculptra, which is a biostimulatory filler, and this is very helpful when I combine it with laser resurfacing or the fractional laser resurfacing because it will help thicken that really thin white stretch mark. By the way, if you want to learn more about collagen stimulatory fillers, please check out this video where I discuss Sculptra and Radiesse, which are both biostimulatory fillers that I commonly use in my practice. There's a newer device that I have been using for jowls and to tighten the lower face. It's called Ellacor. And Ellacor is a microcoring device that removes cores of tissue, which then leads to tightening. I now use Ellacor for stretch marks in the right patient, especially for the whitish or the thinner stretch marks because it can cause tightening of that area. So if you want to learn more about Ellacor, watch this video next where I do a deep dive into this procedure. Thank you so much for watching this video, and I will see you in the next one.